understanding the NCLEX world. And what I am going to do, what I'm going to tell you next, you've probably never heard before. Because every other mentor out there says the contrary to what I'm about to say. You do not need to be an expert in nursing content. I want you to hear me out. I'm not saying that you're not going to study nursing content. What I am saying is that you do not need to be an expert in nursing content. You are not presenting to the medical exam. You're presenting to a nursing exam. So yes, you are going to study content, but you do not need to become an expert. And this is the best way. This is the best image that I have on my mind to show you how the NCLEX is. I don't know how it is in other countries, but here in the US, when you want to become a driver, you have to go to the DMV and do what's it called, a written and a practical test. The day you go for your practical test, an instructor is going to sit by you during this practical test. And that instructor can care less if you know how the fuel injectors in the car works. That instructor don't care if you are an expert in engineering, in mechanical engineering. All they care is that you know how to go straight, backward, right, left, without killing somebody. NCLEX is similar to this. You do not need to be a doctor, but you need to be a safe nurse. So what is the NCLEX? NCLEX is a diagnostic exam that measures your competency level in nursing content and patient care, but this is the key. This is the most important. The purpose of the NCLEX is to identify if you can perform nursing care in a safe and effective way. So how do you prove the NCLEX that you are safe and that you are effective? Answering NCLEX questions the right way. So how do you answer NCLEX questions the right way? You need to know the difference between a recall and recognition style question, an analysis style question, and an application style question. You see, when you take the NCLEX, there are going to be a variety of questions. Some questions are going to be easier than others, and some questions are going to be harder than others. At all times, the NCLEX is going to be measuring if you know how to be safe, if you're going to protect your patient. So the first thing that I want to do is show you in the following slides how to answer and how to identify different style of questions. Because in order to answer recall and recognition style question is different than what you need to know to answer analysis style question or application style question. So let's see the difference in the following slides. Which of the following is a complication that occurs after a percutaneous liver biopsy? We have answer A, nausea and vomiting, constipation, hemorrhage, pain at the biopsy site. So complication, this question is about complication after. This is an important keyword, and we're going to talk about keywords in a little bit. After a percutaneous liver biopsy. Why is this word important? Because if it says before a percutaneous liver biopsy, it's a totally different question. The answer might be different. It might be nursing interventions before the liver biopsy or nursing interventions after the liver biopsy. So which of the following is a complication after a percutaneous liver biopsy? We know that the most important answer is hemorrhage. Why? Because after the percutaneous liver biopsy, the highest risk that we can encounter is hemorrhage. Now, are we going to see pain post percutaneous liver biopsy? Yes. But what is the difference? What does complication means? When you see the word complication, you're looking for something that is unexpected, not expected. You see, pain at the biopsy site is expected because the patient just undergo a percutaneous liver biopsy. So, complication means I'm looking for something unexpected that is going to cause great complication on the patient. So the correct answer is hemorrhage. Good job. Now, this is a recall and recognition style question. Look at this question now. This is a little bit more difficult style of question. You have to really understand what is going on. It says, which of the following symptoms observed after a percutaneous liver biopsy will indicate a complication from the procedure? So, professor, this is about the same question. What's different here? It's the same question. Very similar answers, but there's something new, something different. That's why this question is a little bit harder than the question before. Because now, answer C is still the correct answer, but it does not say hemorrhage. It says tachycardia, a pulse of 120, hypotension, 90/60, and normal respiratory rate. It does not say hemorrhage anywhere, but there are clinical manifestations of hemorrhage or bleeding, which is compensatory tachycardia and hypotension. So this question right here is still a content-based question, but it's a little bit harder than the question before. The real difference between a content style question and an analysis and application style question. See, in this question, you could be an expert at liver biopsy. Maybe you study the standards fully, the whole book, and you still might not be able to answer this question correctly. Because in these types of questions, usually what you will see is multiple correct answers. But you have to identify which one is the priority or the most important. The questions before, they were mainly right or wrong answers. But in this one, you have several answers that could be correct. In other words, in a priority question, you could see a mixture of correct answer, but you have to identify which one is the most important one. So a nurse is providing a care for a client in the medical surgical unit. The unit where the patient is located is important. Which nursing intervention post liver biopsy is the priority? Remember, keyword post biopsy. Why is this post important? Answer number one, assess for the completion of informed consent is a nursing intervention prior to the liver biopsy, not post liver biopsy. So answer number 1, we're going to eliminate. I want you to listen my analysis process. I am not looking for the right answer. I'm looking for an incorrect answer that I can eliminate. I'm using what is called the process of elimination, which is the best technique that you can use to answer NCLEX style questions. So, answer number 1 is eliminated. Answer number 2 says, inform the client of the importance of maintaining bed rest for several hours. Important answer. Answer number 3, assess the biopsy site for bleeding. Very important. And answer number 4, position the client supine to prevent bleeding. Ding, 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 ding. Houston, we have a problem. Why? Anytime you see a change in position in an NCLEX question or an NCLEX answer, you have to think about that position and determine, why would I put the patient in that position and how is it going to help? How is that position change going to help prevent or promote something? So you have to think, is supine position the right position post liver biopsy, and is it really going to prevent bleeding? So that is a very important question you need to ask yourself. So the answer is no, wrong. This is the incorrect position post liver biopsy. Why is it incorrect? Because the patient is positioned on the right side to prevent bleeding, not supine. So answer number 4, I can eliminate. So another answer that I can eliminate. Now we have 2 and 3. We have bed rest, that is important, and assessment. If you use the assessment versus implementation strategy, your answer is going to be answer number 3. Why? Why answer number 3? In this scenario, if you look at the stem of the question, there is no indication that the nurse has completed an assessment. The nurse hasn't completed an assessment. And this does not look like an emergency. So once you learn this strategy, assessment versus implementation, you will learn that in those scenarios where the nurse has not completed an assessment and doesn't look like an emergency, the answer will be assessment, not implementation. If you use Maslow's hierarchy of needs, answer number 2, it is bed rest. Bed rest is physiological. Bleeding is physiological as well, but bleeding is ABC, and ABC has the priority. So if you use assessment versus implementation strategy, answer 3 is the correct answer. If you use Maslow's hierarchy of needs strategy, 3 is the correct answer. So as you can see, you're thinking differently now than what you're probably accustomed to think on an NCLEX style question. So if you look at this question, it's the same topic as the 2 questions before, but the style of question is different. Now you have to think more in depth. Why do we have to assess for bleeding? Because the highest complication or risk involving post-liver biopsy is hemorrhage, bleeding. The same thing that we've been talking about for the past 2 questions. But answer number 3 doesn't say bleeding, doesn't say hypotension, and doesn't say hemorrhage, but it's a nursing intervention that you must do. Another reason why 3 is the answer. 2, when it says inform the client of the importance, that's mainly psychosocial in nature. You're teaching about something. Yes, bed rest is physiological. We know that. But the focus of answer number 2 is more towards teaching. And nursing assessment takes the priority over teaching in this scenario.